Do you know anything about speech therapy or speech pathology? In that case, perhaps I can try and explain. Some people think speech therapists work only with children but not adults. That is simply not the case. Depending on where we work, our patients or clients can even be babies and the very elderly. We help not only with communication but also swallowing. This is how our head and neck look on the inside. Swallowing muscles work together to bring food and drinks into the stomach while closing the airways to prevent coughing and choking. This swallowing mechanism can change due to conditions such as stroke and Parkinson's disease, and it's our job as speech pathologists to manage and improve swallowing. Some children have no problem swallowing, but they can be overly fussy when it comes to eating, and this can be stressful for parents. Some speech pathologists have experience with this and may be able to help. In terms of communication instead of swallowing, we can help people with stuttering and also pronunciation. Be aware that it's alright for young children to have some pronunciation errors, but beyond a certain age, parents may consider consulting a speech therapist. The clarity of our speech can also be affected when there are changes to the muscles, such as after a surgery for tongue cancer. Our brains control all the muscles in our body, including the ones that we use for talking. Therefore, having a stroke, which is a brain injury, can also make someone's speech harder to understand. Sometimes, after a stroke or other conditions that change our brain, our patients or clients can still pronounce words clearly. However, they find it hard to choose the correct words. For instance, they may say hat instead of cat because they sound similar, or they may say dog instead of cat because they are both animals that people often own as pets. In many cases, they start speaking in shorter sentences, and if the illness is severe, they may find it impossible to speak. In such cases, speech therapists may suggest ways to communicate that do not require speaking. For instance, we may create a communication chart. Our patients or clients can point with this to indicate what they need or want. Speech pathologists also help in the learning of vocabulary and grammar. This allows people such as adults after stroke and children with developmental delays to produce longer sentences and express themselves more easily. Our job also includes designing games and activities to teach non-verbal skills, like how to get attention in a polite manner. Last but not least, some speech therapists help to treat changes in voice quality. For instance, the voice can become hoarse, soft, or higher in pitch than usual. These problems can be due to too much singing and shouting, or if someone is not using their voice properly. This can happen especially if they work as teachers, coaches, or singers. Some services that speech pathologists provide have not been covered in this video, but I hope I've covered the main ones. As an example, even though I am a speech therapist, I used to attend classes with a speech therapist to modify my accent. That wasn't because I disliked my accent, but because I was overseas and I wanted more people to understand me. Most speech pathologists are not jack of all trades, and we tend to specialize in a few areas. For instance, I have more experience helping adults with swallowing and language issues. However, I'm still very much interested in most other aspects of speech pathology. So feel free to ask questions and I'll see if I can answer them. Till the next video, I want to say thank you for listening to this. Have a really good day and I hope to see you next time as we delve further into speech therapy.